Hey, everybody, it's Sean Tassone, America's Holistic Gynecologist, author of the Hormone Balance Bible, which I know I say this a lot, but if you really want an understanding of hormone replacement, whether it's in perimenopause, menopause, or even younger, the Hormone Balance Bible right now is on sale at Amazon, 45% off, published through HarperCollins in 2021, talks about the 12 most common hormone imbalances. I really think it's a great way to get started. As always, with my Instagram lives, um, after talking about the Hormone Balance Bible, which I think you should run over to Amazon and get right now because, well, it talks about the 12 most common hormone imbalances in women. So head over and get it. I think it's 45% off right now. But, anyways, what I want to talk about today, we always talk about what women should do or think about doing when they're trying to balance their hormones or when they feel horrible and finding a doctor and whatnot. However, we rarely talk about what you shouldn't do. And I think there's a lot of things that you shouldn't do when you're trying to get help with your hormones. And the reality is, as always, if you have a question, put it in the chat because I will always answer those at the end. So if you have a question about hormones, please drop it in the chat. And if I can answer it, I will. But there's a kind of a few things that I think you shouldn't do. Number one would be don't get a hormone pellet. These companies like BioT, Avexius, and others that manufacture these pellets basically have made a decision to put profits over patients. And I'm going to tell you why. Classic example today. Saw a lady who had a pellet put in March. It was June right now. So 3 months ago. The normal range on a total testosterone for a woman in life, not really related to age, is 2 to 47, give or take, depending on the lab. Hers was 375, which is 8 times normal, 9 times normal. And that was 3 months after the pellet was placed. Can you imagine how high her testosterone? And just for reference, a man's testosterone range is 300 to 1,000. She was in a male level hormone 3 months after they put the pellets in. Who knows what the heck it was 1 month after they put those darn things in. Pellets are awful. They're malpractice. Any other medication in the world that you took enough that was 9 times the normal limit, Tylenol, you would be dead. Your liver would crump. Motrin, ibuprofen, you probably would crunch your kidneys after a while. I mean, it's just not a good way to do things. But somehow these pellet companies like BioT and Avexius have convinced the doctors that they're training that that's okay, that that's normal. 250, normal. Don't have to worry about it. And I'm going to tell you what, there are sequelae, there are long-term consequences from doing that. Your clitoris gets enlarged, your voice deepens, you grow hair, your cholesterol gets thrown off, you can have more heart disease, and this is long term. So I wouldn't use hormone pellets. There's much safer ways, there's better ways, and hormone pellets are just simply profits over patients. The doctors putting them in have decided they're profits over patients, and so have the companies that make these. Second thing I wouldn't do. I wouldn't try to supplement your way out of menopause. Now, perimenopause is a little bit of a different beast, but menopause, when things are basically just zilch, zero, zippo, nada, the chances of you supplementing your way out of that are going to be pretty small. And I say that because I just don't want you to suffer for months and months and months, because there's a lot of supplement companies out there making horribly false claims that you can take their supplement and it's going to be the best thing since sliced bread. And oh, by the way, you got a 30-day money back guarantee. Okay, that's great. But in the fine print at the bottom of the website, it will say you need to take this product for at least 3 months before you figure out if it works or not. Okay, well, by the time you've taken 3 months, you're outside the 30-day money back guarantee window. It's amazing how that works. But suffice it to say, nothing is going to be as good as a hormone to get you out of some of the funk that you have with perimenopause and menopause. Now, supplements are great. I use them. I'm very selective in how I use them. But to say that you are going to feel better in menopause because of a supplement is basically false advertising. in my opinion. So, no pellets. Try not to supplement your way out of things and spend hundreds and thousands of dollars on supplements that you don't know if they're going to work or not. Now, I know this is going to fly in the face of what I'm doing right now, but try not to get all of your information from the internet. There are a lot of quote unquote health experts out there that have absolutely no medical training, or they got their medical training from some fly by night program that gives them a certification that isn't worth the paper that it's printed on. And they are just out there promoting total garbage that they make up to seem somewhat relevant. Vet the people that are giving you the information. Is it somebody that's done an OBGYN residency, that's done 2 years of integrative medicine training, that's written a book on hormones? I mean, I'm obviously talking about myself, but that just tells you I'm not going to go out there and give expert testimony on men's health. If I did, I'd be a hypocrite because I know myself, I think, and I have 3 boys, but that's about my extent of men's health. And I could go to a 2-month course or a 1-month course on men's health and probably, help people, but I would never say I was an expert at it. So these people that are using the words guru and expert and whatever, vet them, make sure that they actually are what they say they are. Something else I wouldn't do if I was a woman seeking help with hormones, I wouldn't be told no, and I wouldn't get frustrated if I was told no. And I'm going to tell you why. I'm guessing because of the article that came out earlier this week, our weekend, from the UK that showed most women, before they even get the diagnosis of menopause, have to see 10 visits with doctors before they'll even get the diagnosis. So that means you're told no a lot, that your symptoms don't mean much, that they're normal, that you're just getting older, that blah, 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 whatever it is. You're being gaslighted. And for you to just take that and be frustrated, I totally understand that. But don't let that get you to the point where you give up, because there are many providers out there like me every day that have been told no on many, many occasions. Please, please. I understand the frustration and I understand the anger, but keep trying, keep pushing, keep opening those doors. You're here for a reason on my webpage, and I'm hoping that the free information that I can give is helpful and that gives you hope that there are people out there. I'm licensed in 27 states. There are other doctors out there like me. Lastly, I would try to stay away from these organizations that now have this national imprint. They're helping, like MIDI Health. I'm not going to disparage MIDI Health, but the word mid means they're mid-level providers. They're usually nurse practitioners. My guess is some of them probably have a limited amount of women's health experience. And from what I've seen, because I've probably seen about 20 women now that have gone to MIDI, they basically get the same treatment they get anywhere else. They're told that they can't do this, they can't do that. They're very limited with their experience with testosterone replacement. And it's really, to me, it's just a money grab. And I just think that the women that I have seen use it because they just don't know what else to do. They can get the help they need at home. But the follow up has been sparse in many occasions. And I think the prescriptions they write are somewhat limited, and they really show that they just don't have a lot of depth in the hormone realm. This is obviously my opinion based on what I've seen from other women that have gone there. Some of these other sites that make all these promises, it just simply isn't the case. And I know that going outside of your insurance can be disheartening. It can be frustrating because I pay $600 a month on my insurance. So I'd like to use it. And I know you would too. The problem is that those of us that have been doing this for a while, and those of us that only do GYN, when you stop doing obstetrics, that's where basically all your income comes from, yet you still have all this overhead. And so I had to get out of the insurance game last year because I was seeing 30 patients a day and I still couldn't pay my bills. So, and that's before I even paid myself. And I'm not, playing my violin, as it were, but that's why I switched to cash. And so it helps me be able to keep my doors open, see the patients that want to be seen, and also allows me to see fewer patients. So let's look at some questions here. Why do the pellet doctors give so much testosterone? Well, one, they're trained that way and they don't ask questions because obviously they're more concerned about money, which then goes to the fact of why they would draw a lab, see that the values are horribly elevated, and say it's normal. I mean, the fact that you could tell a doctor that a lab value is 8 times normal and that's fine, where the hell did they do their training? First, do no harm. That's doing harm to a patient. So to me, that's totally unethical. And I say it all the time. It's malpractice, in my opinion. 72-year-old woman with a 925 calcium artery score, take an estrogen patch, no angina. So here's the problem. A CAC, that's a CT scan of your coronary vessels, and it looks for calcium deposits. That is a high calcium score, which does put you at an increased risk for heart disease. And the problem is when you have an elevated CAC score like that, and you haven't been on estrogen for at least 10 years, or you're over the age of 63. The problem is that estrogen can soften those calcified plaques if it's a new introduction and can cause those calcified plaques to break off and then cause a heart attack. So with a score that high, I would probably try to work with other hormones instead of the estrogen initially to see if we could get you feeling better. Sometimes testosterone will fill in quite nicely for estrogen. Not always, but it can help. Trying to get an appointment with you. I'll try again tomorrow. Very excited. Hey, thanks. You know, we get a lot of calls. I only have 2 people. I keep it lean, but be persistent because we do answer the phones. I just hired another woman last week, and she will be picking up some of that slack. But we do answer the phones, but we do get a lot of phone calls at the same time. So please, please, please don't give up. We're really trying to get everybody seen. Amazing UK would do that. Yeah, I wish. What are your thoughts on Emma Alloy? It's the same. It's a company. I think that one was probably founded by an OBGYN. And I don't know enough about that particular one. I think I know the doctor that owns it. But again, do you feel like you're being taken care of? When these companies have these low price points, like they charge $99 and you get your prescription and all this stuff, the way that they can keep it that cheap is that they do volume. And so because that's it, you either charge a little bit more and do less, or you charge a little and you do tons and tons of volume. It also doesn't connotate consistency. Usually you're going to be seeing a different person every time. Again, I'm not speaking from personal experience, but I've heard this. And the knowledge base could be limited. If I ran one of those programs, then it's possible that you'd run into some of these problems, but I would make sure that I didn't hire somebody that wasn't personally vetted by me. I don't think that that's done. I'm not sure, but I've just heard that consistency is an issue with that company. When should I get my hormones tested? 48 years old, finally off birth control. You get them tested whenever you want. Now, coming off of the birth control, I'd probably wait for 1 or 2 cycles just to make sure that the machine was working again. But don't let people tell you that you can't get your hormones tested. That's another thing that kind of falls into that last something I wouldn't do is don't be told that you can't check your hormones. One, if a doctor says that the insurance won't pay for it, they're just being lazy. Why is that a concern of mine? I should just order it. I'm not paying for it. You are. And that's your desire if that's what you want. It's no skin off of the doctor's back to order labs. They either just don't want to do it, they don't know how to interpret it, or you're being a pain in the butt to them. So push. And if you get pushback, go somewhere else. Vote with your feet. Wow, 36 people here. Rock on, ladies. I'd love it. 61 and just started estradiol progesterone, having terrible breast pain, too much estrogen. Can't answer that for you. Don't know you. I can answer for what I see in my practice. It's very common to have breast pain in the beginning, probably the first couple of weeks. You don't have to, I would call your doctor tomorrow, obviously, and ask them what to do. But sometimes when you start levels too high, your breast tissue can get hit and can swell. And usually that goes away. There's a great company out there that I'm going to put in the chat here. It's an iodine based product. It's a female owned company called Violet Daily, and it's specifically for breast pain. I wouldn't obviously use it unless you've seen a doctor to make sure that there's nothing else going on. But Violet Daily, sometimes I'll tell my patients to go get a prescription if they're suffering from that breast pain. Do you prescribe hormone replacement therapy over the computer like ML does? Yes, that's called telemedicine. Do it all the time. I have to be licensed in the state where you live. I'm currently licensed in 27 states, including the bigs like Florida, California, Texas, New York will probably be in the next 2 weeks, and a smattering of states in between. If you go to my Instagram page, Sean Tassone MD, I will, on the second pinned post at the very top, I have a picture of the United States. It has all the states where I'm currently licensed. You're welcome. What about Virginia? So there is this thing called the IMLCC. What the IMLCC is, it's a compact of states that have all agreed if you're licensed in one state, then you just pay the money and you can be licensed in another state. It makes perfect sense. Virginia, unfortunately, has decided they don't want to do that. So to get into Virginia, you've got to fill out the whole process and blah, blah, blah. So I haven't done Virginia yet because I've been working on California, which I just got. And now I'm working on New York and then Pennsylvania. And I may work on Virginia next, but it probably won't be until the end of the year. I am licensed in Illinois. I saw 2 patients from Chicago today. So, and as long as I'm licensed there, I prescribe medications. So yes. And usually the way I do things is I will see you for your initial visit. I'll schedule a return in 5 weeks. If we get you happy and comfy, we maybe need to see each other every 6 to 12 months, or you get labs drawn whenever you feel like it. As a reminder, since I've got 40 people here, the first step in hormone replacement, it's a shameless plug, but I know a lot of you out there want to know where you can get more information. I wrote a book 2 years ago called The Hormone Balance Bible, almost 3 years ago. It talks about the 12 most common hormone imbalances, talks about testing, talks about each hormone individually, and then has a 6-step process for each of those imbalances that you can go through. 5 of those are things you can do on your own, and only 1 requires me. The hormone piece talks about spiritual practices, infoceuticals, nutrition, exercise, and supplementation for all 6 of those. Am I licensed in New Jersey? Yes. Is there any different in person? In person, you get to meet me personally, and Bernie's not that far away. So, I mean, I'm a lovely person. I'm kidding. Realistically, I like the in person because it just feels more personal to me, and that's the way we used to do things. I'm also happy to do telemedicine. So if you call the office at 512-956-0296, head on over to Amazon. They're having a 45% off sale on my book right now. I don't control that, but you can get the book for $16 or $15, and it's 500 pages. It's more than you'll ever want to know about hormones. It's a great reference book to have, and I think it really will educate you and give you a lot of answers to your questions. So if there's no other questions, this one went 18 minutes. I usually like to keep it under 10, but that went by really quick. So remember, it's not always about what you should do. It's about what you shouldn't do with regards to hormones. I really appreciate you sharing this. I appreciate the subscriptions. We're trying to reach 1 million women if we can. Nothing's going to substitute for education. I want you out there talking about this and sharing it and just, giving other women the information. Thank you so much for being here. I truly love you all, and maybe I'll get to see some of you. Take care.